When you have your girls, you're never alone. You get together for coffee, maybe to work out, or just to laugh. We created Hey Girl, just for you. Can't wait for you to join us.
Hey everybody, welcome back to Hey Girl. Today is Hey Girl episode 4. How about that? And we are
Yes.
so excited that you have joined us. Hey Kim.
Hello, Kim. How are you?
I'm great. So I'm Kim with an E.
And I'm Kim with an I.
And it's so great to have everyone back for another episode. Listen, Hey Girl is an extension of your sister circle. This is a safe space where you can share your experiences and be affirmed, whether you're married or single, stay at home or have a career. Our lives are complex and can at times be overwhelming, but we believe in the power of conversation. Sometimes just knowing you're not alone in the struggle, whatever it is, can help you get through.
Yes.
And that's what this is all about.
Yes. So last week we talked about perseverance with our good
Yes.
friend Amanda. And she
Yes.
told us about pushing through in spite of, what's going on right now with this pandemic. A lot is going on. And for her, neither she nor her husband, had a job and having to move from one place to another place. I mean, just trying to perseverance through that alone
Yeah.
during this time, and everything is crazy. So when she shared that story, it was so inspiring, and just
But
trying to push through things, and just even though things are going on around you, just keep going. And so
right.
Amanda Mandy, she was just wonderful with that. So you'll be delighted by her spirit and personality in spite of her story. So
Yeah.
we're keeping the theme up with perseverance this week because, quite honestly, all of us are struggling. I know
Yeah.
I am in certain way, one and another. Whether it's
Yeah.
with the school, homework and all that stuff, classwork, working, teleworking, and just being a mom. Just trying to keep your house clean, cooking all day, everything.
A lot.
So
Yeah.
yeah, so that's always it has been a struggle in that way. So, Kim, for you,
Yeah.
how has it been during this quarantine for you?
We've talked about this, Kim, and at first I was like, it hasn't been too bad. And you were calling me, girl, I'm going crazy over here. I don't know what I'm gonna do. And I was like, yeah, it's gonna be okay, girl. And over here it was kind of like the first couple of weeks, it was like being on vacation with your family. You get to
Yeah.
sleep in and you're together all the time. Woo.
Yeah.
But Lord have mercy. We're
Yeah,
on
honey.
like month 2 of this thing. And honey, if I have to wash another dish, I'm going to hurt somebody. Seriously. Don't ask me what's for dinner. I don't know. Okay.
Right.
Honestly, I don't know.
Right.
It's a
Right. It's
whole
time to cook it.
situation. We're all kind of starting to feel the pressure. My girls even were great at first, but they have days now where they're like, we're never going to leave this house. Can we just go drive?
You
So,
just want to get
yeah,
out in the house. Just get out of
I
the
think,
house for whatever.
yeah, I think
Hmm.
I think it might be starting to get on us, Kim. I think it might be starting to get to us. But, they're talking about opening things up again. And so it's like,
Yeah,
yay, but no, I don't know.
I know.
I'm
You
not
feel nervous
sure.
about it.
Yeah.
Yeah.
I mean, yeah, so it's just a lot to figure
It's
out
a
right now.
lot. It is a
It's
lot.
changing every day. There's so much uncertainty.
Yeah, it
I think
is.
we're all worried about, our family's health and our own
It,
health and
yeah, in the
yeah,
midst of this whole thing. Yeah.
exactly.
So we thought it would be a good idea, along with the perseverance theme and everything, about talking to someone that knows a little bit more about viruses. And who better than our friend Elaine Vanterpool? And you're gonna love this conversation.
Yeah, I
Um,
mean, it's awesome when you have girlfriends who are also smart. I mean,
right, right, right.
that is awesome. So, yeah, we have Elaine with us today. Elaine is a big deal. She's a
Yes.
PhD. She has a PhD in microbiology and molecular genetics and expertise in microbial pathogenics, from Loma Linda University. Yes, I had to practice that a few times. In her early graduate career, she investigated the pathology of cervical cancer, which is a viral-induced cancer. During her doctoral training, Elaine has continued her research in microbial pathogenesis and received NIH and NSF Foundation grants and funding for her research. She is, listen, I told you she's a big deal. She is currently the chair of the Department of Biological Sciences at Oakwood University. And there she serves as an institutional committees, including the COVID-19 Action Task Force, which is also the reason we have her here to guide us as well. She lends her expertise to help OU to strategically and efficiently transition the university during the rapidly spreading virus, COVID-19 virus, or pandemic, I should say. So listen, Elaine, welcome. We are so excited.
Hi, how are you? Hey, ladies.
Hey,
Yes. You know, kind of crazy because, we're in a crazy time, but, this is my area. So it's kind of exciting, even though it's crazy. You know what I mean?
Right. Yeah. So I'm interested in hearing how you're kind of balancing the professional Elaine versus the personal Elaine. Because you got a lot going on there.
It's wild because, not only am I a professional, but I also have 4 kids.
Right.
Yeah. Married for 19 years. My oldest is 17. He is the introvert, so he's loving this. My youngest, she is 10. She's a diva. I'm telling you, she is the one that's a little struggling, just a little bit, because she likes to go out. She's very social. She calls her friends all the time. So it's been a very interesting, thing.
Oh.
Right. Yeah. We didn't even mention that the personalities, how the different personalities are handling this quarantine, right? Like you said, the extrovert is like, I'm dying. And the introvert is like, this could go on forever.
Right.
Yeah. And this is it's a transition. Let's just put it that. I think the whole United States or the whole world for that matter has been put into a shockwave at this point.
It happened so fast. It was like a switch flipped and everybody was just shut down just like that.
Yeah.
So how has quarantine and the coronavirus affected you personally, just like kind of in the day-to-day living?
Well, I don't know where to start. With the cooking, I mean, I've gotten to a point that I said, I don't know if I want to cook anymore. It's so bad. The kitchen sink is like mountain full of dishes. And I'm always the kids, I said, listen, you guys need to come do these dishes. And even it's even gotten to the point that I'm like, you girls, talking about my Jasmine, she's 13, Janai, she's 10. I said, y'all are responsible for dinner. I'm not cooking it tonight. It's on you. And they go and do it. It's a lot of busy work.
Yeah.
Balancing work and wife and cooking.
Yeah.
It's just a lot. And the Zoom meetings I have no words.
Yeah.
Man.
All day Zoom meetings. Yeah.
Oh, goodness.
It's a lot.
Yeah.
So has anything surprised you about yourself, Elaine, during this time?
Well, I'm surprised I can actually do my eyebrows.
Done. Teach me. I'm struggling.
You have to develop new skills.
Elaine, you have to teach me.
Right. Let me tell you. So I had my husband, Jevin. You guys know Jevin. He's so great. Probably like a year ago, he got me this flawless brow. And I didn't open the box until we went into quarantine. Yes.
Oh, you must share.
Okay. What's the deal with the bra?
The flawless brow. It just removes the hair.
Oh,
it's just
brow. I said bra.
Yeah.
Oh, like, no. We're talking about eyebrows. You lost me.
Oh, no.
Okay, I'm back.
No, but the other thing is, it amazes me how we can adapt so much.
Yeah.
Like my house has become a taekwondo dojo. It has become a classroom. It has become a conservatory for music. I mean, it has dance studio. I mean, it's amazing. Yeah.
And I bet all things are going on at the same time.
Yes. Yes, and when they have school, they're placed everywhere, all over the house. So that means I stick to my room. I have a nice sinkhole in my bed now from just sitting on the bed with my laptop, and yeah.
Yeah. I mean, we
Life
turn
sounds a
our
lot like
home.
ours.
Yeah. I mean, every place there's a space for something. I'm like, good thing we're not visiting. No one's going to come over because we're all over the house.
You
Yeah.
are right. You're
Yeah,
All over the house.
right. Everywhere.
I agree. I
Yes.
agree. So,
Yes.
what is then your greatest fear regarding this transition now? So, like, as much as we're ready to get away from the crazy that is our lives, what fears do you have about us going back to life, if that's even possible?
Okay, that's a really important question. And this is something that's been on my mind for a while. My biggest fear is that now that we're transitioning, is that we're not going to transition properly.
Mm.
Everybody is jumping to open, but the question is, are we ready? And the guidelines that we're putting out, is it the right thing? Because if we don't do this right, it's going to be bad. That's how it is.
Right.
In our field, as a scientist, we look at data, we look at trends, and right now, I don't think we're doing it right. And I've gone to the stores and I'm looking at some people, I'm like, what are you doing? So that's
Yeah.
the biggest fear.
Yeah.
That's my biggest fear.
Yeah. There's a lot of information that's coming at us, and it's hard to know who we should listen to, right? Like, we have Governor Ivey, who's opened up the state of Alabama. Barbershops can go back to barbering, and hairstylists can go back to doing what they did before.
Right.
Do you think, you hinted at this, but do you think it's safe for the governor to say, hey, let's just go back to things as they were?
Okay, so I look at the facts. Okay, and I think we all need to look at the facts. I know we are all bursting. We want to go back out. We want to go back to society. I know a lot of people are in financial strap. I mean, this is a sad situation, but the facts are, to prevent infectious diseases, the thing that we must do, studies find that if you put distance between you and other people, infection transmission decreases. That's just common sense knowledge. Another thing too is, the less that you're out, the less likely you're about to touch something that may have the virus on it. You know what I mean? So, keeping distance is good. The social distance. Now, they said 6 feet, but there are studies that actually came out at an institute in Florida that's 12 feet. And they actually had a simulation.
My goodness.
Right. And they had a dummy that had a simulation of a cough. And it went out, 6 feet. Right. But then it kept going out to 12 feet. And I'm like, this is not a good situation. Right. Because this, we don't know exactly what's going on with this virus.
Right. And that's why I feel like it's so important, though, for the mask. Like, I can see the thing with the gloves, because honestly, I'm seeing people ride around in cars with their gloves on after leaving the store. I'm like, you're everything you touch from that point is going to get the virus. So forget the gloves, but definitely need the mask.
Yes.
I mean, I think. But what do you think about the gloves versus like the mask? Do we need both, or should we just?
Okay, so let's talk about infection transmission. To go to the whole salons and all those things. Now, just imagine that you were sitting in your salon, stylist seat, and you don't know, she could be an asymptomatic carrier, of the virus. And if she goes and sneezes on you accidentally, or cough or whatever, and she coughs in her hand and she's touching stuff, she can get it on you. Now, let's talk about masks and gloves. Okay. So I know a lot of people talk about, oh, we can't wear the N95 mask, so we shouldn't wear it. It doesn't make any sense. The N95 is really good, especially for the workers. We need to keep that for the frontline workers. But the cloth mask is more so of protection of other people, right? So you got to think, even though you may not have the coronavirus, but you have to think like, I may have it, right? So if you put your mask on and I'll talk about gloves in a second, and you go outside, unless you accidentally sneeze or you cough or whatever, that mask will prevent the spray. And the research actually shows that, it prevents the spray from going out. So you don't have to worry about somebody close to you actually getting that. So the mask is more so for protection of other people, right? If everyone's wearing masks, you're protecting everyone. Now the gloves, now I tend to wear gloves. I take the gloves from my lab, but the gloves are really good because, like I said, you can get this virus from touching things, like we call them fomites. So you may touch a door handle. Just imagine going to a gas station. You think they clean those pumps? No. So you go different places. You don't know who touched it. Someone could have sneezed into their hand and touch it, and then you come right after. So wearing gloves, if you have, is good. If not, washing your hands is good enough. It's really good actually, and hand sanitizer. But gloves, if you have it, I would recommend wearing it.
Wearing them as well. Well, I tell you, it's an entire situation for me going into public places now. I mean, at the grocery store, I'm getting what I need. As soon as I get in the car, I'm like wiping down, spraying down. I'm almost in a sweat just because I'm such
so
a
much work.
germaphobe. It's so much work. I get home, I'm spraying down my clothes, I'm spraying down the groceries. It's a lot. It's a lot.
Go ahead.
No, go ahead.
So I was just going to say, all that stuff that you just described, I want to ask Elaine, is that overkill or is that what we all need to be doing?
Well,
is Kim the extreme or are we all not doing enough?
No, Elaine. No, Elaine.
I know some people that are terrified to even go outside. And when they go outside, if they had a hazmat suit, they would wear it. I think that would be Kim.
That would be Kim.
I just think, wearing a mask and practicing good hygiene, touching your face is more, so unless you're wearing a hazmat suit, it's no guarantee that you're going to stay away from the virus. We know that.
Right.
And you just have to make sure that, you take the precautions that the CDC puts out, those guidelines. They are the professional. The professional CDC, NIH, they're the ones you need to listen to. And they're saying masks are fine. Washing your hands is good. Now, spraying yourself with Lysol, I don't know about that.
But the germs, Elaine.
I know you can clean down your cans and your food. That's fine, because if you go to the grocery store, you see people touching up all kinds of stuff.
Yes.
Yes. So that's warranted. I've heard people scared to get fruits because people are touching it.
Right.
Fruits,
Just wash your fruits. Wash your fruits. Yeah.
Now, I have a question. Sorry, Kim, I keep cutting you off. Go ahead.
No, go, Kim. You let me go first time. Go ahead.
It's okay. No, I was just going to piggyback on what you were saying about the different precautions. And I was wondering if coming in from the grocery store, if it's necessary to strip all the clothes off and throw them immediately in the laundry, to what extent, you talked about surfaces, but to what extent do we need to be concerned about the clothing we have on when we come back into our homes?
All right. So that's a really important question. Now, it depends. If you are on the front line or you're constantly in front of or around people that have illnesses like that, then yes. If you work at a clinic or urgent care hospital,
that
yes.
Makes sense.
Yes, for sure. If you are social distancing, you wouldn't have to have that problem. So if you're going to the store and you're staying away from people, not being around people, you're not hugging up people, you shouldn't have to worry much about the clothes unless you're around people that are coughing and this. If you're around people like that, then yes. So there were a couple of stories I saw, all over the news. It touched my heart. I really pay respect to these first line workers. They do so much.
Yes.
And there was a medical emergency room doctor that converted his garage to a quarantine zone because he saw so many, COVID patients and he did not want to bring that home to his family. So generally, no, you don't have to change your clothes if you follow the guidelines that the CDC put out, social distancing. Now, if you're around people that are sick, then yes, please change your clothes.
Yeah. Yeah.
Jacob, you had a question.
So with the, for the barbershops and salons, opening up, which, for me, I'm really getting creative with this hair. I need my hair done, Elaine. I need a hair. So I'm struggling.
So when can she go back to get her hair done? That's what she wants to know.
I know.
Okay. I'm in this. So I'm with you. I've seen some people, I said, yes, you do need cuts. But, right now, my thing is, if your salon person has everything in place,
Yes.
are they putting distance? Are they clean? Because you got to think about it. If you're paying, for the duties that, that they're doing, you got to touch the keypads, for the credit card or debit card. Was it
Hmm.
clean? You got to open these doors. How many people do they have in there? Do they have a
Right, at one time. Yeah.
maybe if there's a shield and you're sitting on one side and the other side, the other thing you got to take you know, in mind is that this virus can circulate in the air in a
Mm.
closed space, right? So if they did it outside, maybe that might be something. So if they're following the proper guidelines, yes. But
Hmm.
as for me, just saying, I probably won't get it done right now. That's just me.
Okay.
Once some people are having struggles. Yes, I
Yes.
understand.
Oh yeah. Oh
Yeah,
yeah.
but you got to take the precaution, and you must wear a mask.
Right.
Must.
Right. So along though with the barbershops and the salons is opening though, but the churches now. I mean,
Mhm.
Governor Kay obviously said the churches are allowed to open. Now, of course, the church we attend, I mean, there's a lot of people in church. So do you think it's safe to do that now?
That's a good question. Now, before I answer that, I just want to let you know that some of the larger outbreaks that has happened, like clusters, started
Right.
from church gatherings or
Right.
religious gatherings, because you have people in close proximity, people that are in church, they're friendly, that's their family, so
Right.
they're socially in contact. And to me that is kind of, it's a hard thing, because you have doors of the church. It depends if they follow those guidelines, where people are not touching things that other people touch, like the offering basket, you know,
Right.
the door handles. I mean, unless you can keep the door wide open, you're going to have to space people out big time, but then it's still a circulating thing. I've gone to church. I'm not going to say the church, but I've been sitting where a person was just laid out on the pew sick,
Oh my.
right? And I had to go tell a deacon. And then you have other people hacking up a lung, and my kids are like, "Mommy, should we
Right.
even be here?" And
Right.
I
people
mean,
are gonna go to
students.
church regardless. And the bathrooms. All right, who's gonna sit there and clean the bathrooms every time someone goes in and out? So
Right.
if they follow the proper guidelines, it should be okay. But just to, for me, I will be streaming church service for a little while longer. Just
I
my
would too.
yeah,
Yeah.
Yeah, I mean, because you say if they proper follow the proper guidelines, but the guidelines are so stringent,
it
how
is.
can they follow them? You know what I mean? Like to that extent, if you're talking about a large church and lots of
Mhm.
people moving in and out, you don't have enough people to wipe down every 2 minutes.
Right.
Right. And I
Right.
saw something, actually, it was interesting, that some pastors actually locally were talking about maybe having a separate church service for the elderly. I thought that was actually good. You can spread out the
Mhm.
elderly and just make sure they're not touching each other, because, they're not the ones that would be more inclined to stream. You know what I mean?
Yeah,
Right.
So
yeah.
maybe that's something they can do, because, if they're scattered, if they have social distancing and don't touch up everything, it should be okay.
Hmm.
Yeah.
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 Well, we have a question about traveling.
Oh,
Do you think it's safe right now to travel the next few months? I mean, for me, just before we had to shut down, I was supposed to go on a work trip and I canceled before. I was like, you guys, this stuff is going fast. It's coming this way. I'm not going.
mhm.
And needless to say, a week prior to that, us having to leave, they canceled the trip. So do you think it's safe? And when do you think it'll be safe to travel again? I mean, just sitting in those planes alone. I mean, I was
Mhm.
wearing masks before and wiping down. I mean, those
Mhm.
vents. So when do you think it'll be safe?
Well, I know that the airlines have actually put a lot of more stringent rules in place. Like, you have
Hmm.
to wear masks on the plane.
Mhm.
But, but the plane is not a very large space, and you're
Right.
gonna have
Right.
a lot of people. Even if you're wearing a mask, especially if it's not an N95 mask, the longer you are staying in proximity to a person, is the higher the chance, even if you're wearing a mask, just the exposure of being around each other. And you think about it, the air is circulating in the plane.
Right.
Yeah.
That's what I was
Right.
going to say.
Right.
Yeah.
Circulating. And so if you have someone coughing, we've seen those movies like Contagion, and
Yes.
we've seen, Outbreak, and, it's a nightmare on the plane. I mean, it depends. If the plane is highly scattered, like one person on the plane, which there was actually a picture that I saw online. There was
I
one
think I
person
saw the
on
same
the
thing.
plane. Exactly.
Yeah.
Yeah.
They're trying to clean in between. But for me, in my house, you want to know what I would do? I would
What's that?
drive. First of all, if I don't stay home,
Yeah.
I would drive.
Yeah.
It's
At least for right
in
now.
your
Yeah.
car. We've driven to California and back. It's rough.
Yeah.
If you ultimately must travel, like if it's essential, it's
Mm-hmm.
better to drive. And you got to take precautions. If you're staying in hotels, you still got to take those precautions. It's a very odd time right now.
It is.
So you've talked about masks and gloves and washing your hands and wiping things down. Are there any other measures that we haven't yet mentioned that we might do to protect ourselves? Or is that basically all we can do right now?
That's pretty much it. And if you know of anyone that has any type of symptom, just make sure that you stay a far distance from them. Like if you're in an area, or you shouldn't be in any crowds right now, but if you're in an area where you see a lot of people, you hear coughing and sneezing, it could be nothing. It could be allergies, but you don't know.
Right.
So you need to stay away, and you got to be careful not to touch up your face. That
Right.
the virus enters into the nose and mouth. And so you got to make sure that you keep your hands and stuff away. But the best thing is to stay at home if you can. That doesn't mean you're fine in your house. You can go outside. You can sit outside. You can take a walk around your neighborhood. That's fine. You actually should do that. But don't congregate with people.
Right.
Yeah.
Right. So
I have
about.
Sorry, go ahead. Real quick.
We talked about go ahead, Kim.
When you were talking about, taking things in through your nose and that being sort of the danger, I have a friend who has actually made it a practice to put inside the walls of her nostrils Neosporin, or like antibiotic ointment, as a way to kind of create a, it kills, bacteria, or use it on cuts and things like that. But she puts it in her nose because she feels like if she does happen to breathe something, it'll catch it. Are you familiar with that as a preventative measure?
Neosporin is an actual antibacterial agent. It does nothing for bacteria. Inside our nose, we have natural barriers that, we call them first line barriers, that will actually trap and block viruses and block things out from getting inside. Now, my thing with that, the petroleum in it might actually trap dust and things, but the virus can just go right bypass that. And it's probably slicking down the hair in the nose. So if you're doing that, it's going to bypass it. And I wouldn't do it. Especially you have bacteria in your nostrils that's needed. They are your barriers as well. And if you go ahead and you kill that normal defense that you have, you set yourself up for other pathogens. So me personally, I would not do that at all. Now, if she wants to do something and maybe flush out the nose with saline, she could do that. But that's not even a guaranteed measure that it will actually work. You know what I mean? But yeah, I wouldn't use Neosporin, not for that particular case. No.
So it doesn't serve that purpose, in other words.
Yeah, it might actually impede your immune protective.
Wow.
Yeah.
Wow.
Okay.
Well, I saw something interesting on CNN, and I was like, wow, I didn't think about that. But it was about a person that for men, if they've had coronavirus and they did the 14-day of quarantine and all that, that even after that, that the virus can still live in their semen.
I saw that. Oh my God.
You saw that? Oh,
I
was like, wait a minute, read that again. So,
yes. Oh, no, nothing is sacred.
I was not surprised. I really was not surprised. So, I'm going to take you back just a little bit with that Ebola. You remember the Ebola?
Yes.
What's going on?
Yeah.
What's going on? That was some serious stuff. I
Yeah.
mean, Ebola got here and spread, forget it. But anyway, what they found that people that got better from Ebola, they
Hmm.
found that some of those individuals, they still had it in their eye, even though they were okay. Right. And
Wow.
so, and then, with the Zika virus, it can be transmitted through, sexual encounter. But
Hmm.
this one, I wasn't surprised. Okay. So, just to give you a little bit of science behind it, not sure if you're interested, but still let you know. So, there are a few organs in your body, we call them immune privileged. So, the
Hmm.
reproductive organs, like, your reproductive your organs like the uterus,
Hmm.
testes, your eyes, your brain. These are areas we call immune privilege. That means that the immune system really doesn't battle hard in those areas. And if you think about like a woman with the uterus, I mean, she's going to hold the baby there. You know what I mean? So, and the brain is protected, so is the eye. So that's when people have massive trauma to the eye, they can actually become blind later on. It's because of that whole thing.
Hmm.
So even though they may be better system wise, right? They may be negative or whatever, the virus can still be in the reproductive tract because the immune system really doesn't battle that hard right there. The question though is the $1 million question.
Yes.
You and your husband are following biblical principles. Will you get it? I mean, that is a really good question.
Right.
No one knows. So even though the virus is there, it doesn't mean it's effective.
Wow.
Maybe there's something in the semen that block it from being, or maybe not. Maybe it might accelerate it. We don't know. I really think medical doctors and scientists really need to look at this. Even with the
Yeah.
woman with the cervix, are they
Hmm.
shedding the virus? If you're
Right.
shedding the virus, there is a chance, and that's scary. So the same article said, you know what they said, right? They said use a yeah, they said
Oh,
use a condom because they said they don't know if it would
just
transmit.
in case.
Wow.
Yeah,
Yeah.
but we
Yeah.
need to
And I
look at
think,
this. We need to look at this.
yeah. Well, I think that's the thing that, right? There's just so many unknowns. There's so many questions that are still out there
Hmm.
unanswered.
Yeah.
And you just have to kind of err on the side of caution, I guess, because you don't know for sure.
But it's a rough situation though. If your husband couldn't touch you for 2 weeks or
For
Oh
don't,
2 weeks.
man.
For two weeks.
That's
that's a rough situation.
like,
You gotta sympathize.
I
You know,
know.
I'm just
That's
like,
adding insult to injury.
right, they're talking about divorce rates going up because of that
Right.
situation. We don't
They
want this to
probably
add to.
definitely go up. If he comes back after 2 weeks, he's like, they can't touch you.
Right,
Oh,
lack of intimacy.
goodness
Right.
gracious.
Yes.
Okay. So I know that there are individuals who are sort of at risk, at highest risk for contracting, or if they were to get it, they would certainly be at a greater risk of
Hmm.
getting the worst symptoms. So can we talk a little bit about some of those pre-existing conditions that people have? Because I think we may assume, oh, I'm fine. I don't have any pre-existing conditions. I'm not at risk, but maybe we do. And we don't really
Right.
realize that thing that we've dealt with our whole life is actually a thing that compromises our immune system. So can you kind
Right.
of through what some of those things might be?
Right. And I've seen people on TV when the news reporters are asking civilians, they said, "Oh, I'm not at risk. They'll be my age or even younger. I'm not at risk. I'm fine." I just want to first say that everybody's at risk. Everybody. We see the kids now are coming out with these autoimmune disorders like Kawasaki syndrome. That's like a cardiovascular autoimmune event. Um, and we're seeing these deaths, but I'm going to talk about the higher risk categories. Okay. So the
Mhm.
higher risk, we obviously know elderly, the age. If a person is elderly, that will for sure put them at higher risk just because their immune system isn't as strong as
Hmm.
someone else that's our age, right?
So let me stop you right there, Elaine. Let's talk about that age. Is there a tipping point when you're past a certain age that you're considered elderly? You know what I mean? Like,
Well, well, initially they said 65. but they
Okay.
have dropped it down because I actually saw more and more people. But 65 is generally, like when I'm teaching my students, we usually
Okay.
say 65 and older is that stage where someone is elderly and they may be immunocompromised, right?
Okay.
So it's
Mhm.
about 65. But like I said, um, it could be younger than that. Okay. So
Okay.
age definitely is a factor. Now, what they're finding that a lot of the individuals that have cardiovascular diseases, so that also includes like hypertension, that's high blood pressure, or any
Mhm.
cardiovascular issues, right? They are at highest risk. We find blood clots, forming in these people out of nowhere, and that's
Mm.
actually causing some of the fatalities, right? People
Wow.
that are diabetics, there are a lot of diabetics in our country,
Mhm.
so diabetes puts you at risk because that is an inflammatory disease. It can lead to systemic issues throughout the body. People that have, autoimmune disorders like multiple sclerosis, rheumatoid arthritis, those things, that's an inflammatory type disorder. And there, a lot of them are on medications that may also immunosuppress them. Um, we also have, how am I going to put this? Um, we have individuals. I don't want to scare anybody, so I'm trying to be nice here. Um,
Uh-oh.
People that have respiratory disorders like asthma. There are
Hmm.
so many individuals with asthma. My oldest
Yeah.
son, even though he's not severe, he has asthma, and even though we may be healthy, let's say we don't have any of those high risk factors, you go out and you become an asymptomatic carrier, you can spread it to that person
Absolutely.
that has,
Absolutely. And my daughter's like that. I mean, she has asthma. So that's why I'm so
yeah,
careful, about bringing it home.
yeah.
Yes.
Right. And listen, I didn't want to scare anybody because there's so many kids and adults that have asthma. But
Hmm.
yeah, and COPD, if you smoke, you just put yourself up in a higher category, no matter what
Hmm.
your age. I mean, because
Mm.
it really does some damage to the lungs. And there was something else that, I saw, it's kind of broad, and that's obesity. Okay,
Mm.
because it's usually associated with a lot of stuff. But I have to put this here. It blows my mind to see how many minorities are actually being impacted by this virus. It is a
Yeah.
health disparity. It's really sad to see that. Um, a lot of them actually have underlying disorders.
Right.
Right.
It's sad. So there's those that are high risk. There's others as well. You know,
Mhm.
symptoms may range, but it doesn't matter. They're the ones that are high risk of getting it.
So,
Hmm.
question for you. Both of you talked about you have children who have asthma. Does it help that they are young? Because you also mentioned that age is a risk factor. But if you are a young person, which puts you at a lower risk, yet you have asthma, which maybe pushes you up to having a greater risk, is there any way that one can kind of mediate the other, such that maybe a child with asthma would have a better chance of being okay than, say, an elderly person with asthma?
Well, for sure, you got to make sure that they're a little bit more protective. You have to make sure you don't bring it home. That's one. But two, if
Mhm.
they have the inflammatory condition under control,
Hmm.
the chances of complications a lot less, right? So if their asthma is staying under control, and them being young, they found very few deaths in individuals 17 and younger. So despite of them having conditions like asthma, they
Gotcha.
may get sick, they may be hacking up a lung, but they will most likely won't be in the hospital with ventilators and things like that. So
Right.
just
Gotcha.
make sure that they're not make sure that they're taking their medication regularly, because one thing about inflammation, it's a domino effect. So if
Mm.
you have a small inflammatory response, it will trigger a bigger inflammatory response until it exaggerates out of control. So if you keep it under control, you can prevent those severe complications.
Mm.
Got you. I
Well,
see
we had
some
a
questions
question.
coming
Yeah,
in.
I saw a
Yeah.
question. Elaine, someone asked, can it affect someone who has to sleep with a CPAP?
Oh, well, CPAP, if you clean your CPAP, you should be okay. Now,
Okay.
if you were sick with it, you know, and the virus is still linger on, you have to really clean that. I mean, there are things that's out there. They have these UV sterilizers for parts of the CPAP. I would
Hmm.
make sure I clean it. But if you don't have the virus, I mean, you can't. reinfect yourself if you never had it to begin with. So, but
Okay.
I would recommend, because CPAP has been linked to other infections, not just viral infections, just bacterial infections in general. So you must make sure you clean the CPAP just in general.
Okay. I see another question. Let's see. Karen, a friend's doctor mentioned that we could all get it now, get it over with, and then the second time it wouldn't be as bad. What are your thoughts on the second round of the virus?
Okay, so that's actually a really good question. So I will just bounce back to the Spanish flu back in 1918. The first wave is kind of looking like how we are right now, right? So we did have, a lot of people getting sick or people dying, and then it kind of, settled off a little bit as the summer came. Then the second wave hit, and then, back, coming into the fall, winter season, and it was 2 to 3 times worse than the first wave, right? And so that the virus itself actually mutated, right? And came back with a vengeance. Now, with this one, people are saying just go out and just get it and get over with it. I mean, that, that sounds all fine and dandy, but it's not about just going out and just getting it and getting sick, because the whole reason why they're flattening the curve is so you don't overwhelm the medical system. If you don't flatten the curve, everyone just going out and getting sick, you have this high peak. And if you don't have enough space in the hospitals, you're going to end up with 2, 3, 4 times the amount of deaths that if you just spread it out and you have enough medical beds, enough ventilators. New York, they were trying to gear up for that big surge that they were planning, but because of the measures they put in, it flattened that curve, and they're on the downside. This is really good, encouraging, seeing what's happening in my home state, New York. So it's not about, let's all just get it and get better. It's about overwhelming the medical system and having a lot more deaths. But I mean, if we could all just get it now, hunker down, knowing that, there wouldn't be so much deaths, I was like, sure. But it's the deaths that are the concern. So that's why we put those measures in place.
Yeah, and so isn't that what makes this particular virus different from others? The fact that it's just more, what's the word? It doesn't go away. It's not like I heard another doctor friend say it's just not behaving the way other viruses have that we have seen before.
Right.
This is a novel virus. There's other coronaviruses out there. I mean, this is not the first one, but these are novel. We have the SARS, we have the MERS, now we have the SARS-CoV-2. That's what the COVID virus is, SARS-CoV-2. It's novel, and the reason why I say that, because it's a mystery. We don't know what it's going to do. Every time we turn, you heard of COVID toes. I mean, we're hearing of all these weird things.
COVID toes.
We're hearing of these things. No one knows. Pregnant women aren't as impacted as much. They're seeing, where the flu virus will wipe somebody out if they were pregnant. So really a lot that we don't know about this virus. And, I pray that this virus does not mutate. They're saying that there's tiny mutations, which is good, not large mutations, but there's evidence that it is mutating, because for it jumping from animal to human, and now they're finding pets. They found a dog. They're finding
lions and zoos.
Yeah,
I saw that.
So for it to so quickly jump into the pets, it's telling me it's mutating. So we don't know what's going to happen. We honestly don't.
Yeah. Right. So with the unknown, it's probably be our last question. I'm not sure. But as far as like a vaccine for this virus, I honestly, when it comes out, whenever it comes out, I won't be the first one running to go get it. I need that thing to be tested a couple of times, to see how it reacts. Because if it's like the flu, for the flu vaccine, it's a live virus that you're getting. So what are your thoughts on that for that vaccine whenever it comes out? I think people that have asthma and all those pre-existing conditions, they would definitely have to step back and say, I can't be the first one to go out and get this vaccine first.
Yeah.
You know?
Well, let me tell you, to get a new vaccine, it takes a lot. It takes a lot of work, a lot of study. You have to see, what happens long term. You have to look at adverse effects. And it usually takes about a year and a half. And that's why you keep seeing, I've worked in my graduate studies on those same type of things. And I know it takes a while to develop it. So here's my thing. As a scientist, I look at the data. I scrutinize everything back and front, inside out. And so if I'm looking at the reports and I'm looking at the data, and if once it shows that it is safe and that it's effective, I mean, I don't know how long that will be because everyone's rushing the vaccines now. Okay.
Yeah.
If I see it's safe, I will be the first one in line. I have to see the data.
Yeah.
I have to see it. Right. Now, I remember back in the day, the Gardasil vaccine, when it first came out, there was a lot of controversy about it, and they corrected whatever issue that it was. But, you just got to just look at the data. And I don't blame you. I really don't blame you. I kind of think like too, right?
So we don't need to rush necessarily, even though they're rushing the vaccine. We need to kind of wait it out and see what the data shows.
The one thing that I will say, this fall season that's coming through, kids are going back to school.
Yes.
We think they may be going back to school. People are going to be coming back together. And, kids are germ magnets. They're predicting the flu and the coronavirus coming back at the same time. So they're advising, we don't want those two together. They will really slam that immune system really, really hard. So to have some kind of protection, maybe through the flu vaccine, would be a good option because you would have some protection against that. I don't know if a coronavirus vaccine will be made then. I highly doubt it. If it is, I will be surprised. I would really be surprised. Yeah.
So we have another question from one of our viewers. Hey, Katrina. She is asking, it disappeared off my screen. It was something about what actions can people take? Kim Jacobs, can you see that question? It disappeared off my screen.
I saw it, but I saw a little bit of it. I think it asked, if you go to an OBGYN or a doctor's office, what measures you can take. I think that's what it asked.
That's actually a good question. If that's what it was, Katrina, maybe put your question up again.
Yeah.
I actually had a similar question about going back for doctor's appointment. A lot of doctor's appointments were pushed off because of the shutdown. But what about going back to those appointments now? Is it recommended or no?
Yeah. What safety measures?
Well, I know a lot of doctors' offices are taking precautions, which is good. But just bring that mask. Don't touch up anything. If you don't have to, bring your hand sanitizer if you don't have gloves. Just keep that mask on because you're in a facility that people might be sick. Now, OBGYN, they're pregnant women. They're not going there because they're ill, but still, you still got to take that precaution.
And I know a lot of people
just be safe, be careful.
Yes, be careful.
Yeah, I know I have an appointment next week, and they've already sent an email saying, we're going to take your temperature soon. When you get here, we have masks available that you could purchase for $1, which means you have to have a mask.
Yes.
When you're in there. So I think a lot of people have taken those measures, especially doctors' offices. Checking your temperature before you even walk in, and not having several people to attend the appointment with you. So there's offices taking those measures.
Yeah, them being medical professionals, they're concerned about themselves as well.
Yes,
and their staff. Yeah,
they are. That's why they're taking these steps, these measures. Yeah. So it should generally be safe as long as whoever's the patient is protecting themselves.
Right. Well, Dr. Vanterpool, Elaine Vanterpool, it's been so nice. And you'll have to, there's other questions I know we probably didn't get to, and probably if you could go back and maybe answer some of those questions for people after this call. And we're going to have you back. I mean, because I think even a month from now, we're going to still have some answers. I mean, some questions for you.
Questions, particularly because we're worried about going back to school and what that's going to look like.
Yes. That's a concern. That is a concern.
Yeah.
Yes.
So how do you keep your own fears at bay? Because I think we've talked about a lot of scary stuff, and I'm sure people are kind of feeling like, oh, there's so much we don't know, and there's only so much we can do to protect ourselves. What do you do to sort of keep from feeling, overwhelmed by all of this?
Right. I mean, you can be paranoid hearing this, but the facts are that most Americans that get this, or most people, they won't be severely ill, that they will die from it. They will, if they get sick or asymptomatic. So that's good. That's one good thing. And just make sure that you are aware of your symptoms, you're aware of your surroundings, that you're not around these people, and pray. Every day I pray, Lord, your protection. I said, I will do what I can, but Lord, you got to do the rest. I thank every day for an immune system. I mean, a lot of people don't realize how powerful their immune system is. And we've encountered things. You may have encountered it and not know, So just remember that you most likely will be okay. So not to be too scared about it.
Right. And definitely, like you said, having peace with it and not, being so scared. Of course, it's a scary time. So in referencing and knowing that, God has you, he has it in control, and so we always want to bring, the conversation back to scripture. So I'm going to read some scripture references for this, just to kind of ease your mind when you're getting worried or, having anxiety about everything. Because I know the first week or two, I was just so nervous to do anything. So Matthew 5:32 says, "Don't worry about your life, for your heavenly Father knows what you need." And surely he does. He knows your heart. He knows what you need. And in John 14:27 says, "Peace I leave with you. My peace I give unto you. Not as the world giveth, give I unto you. Let not your heart be troubled, neither let it be afraid." And our last Bible scriptural reference is Philippians 4:6-7 says, "Be anxious for nothing, but in everything by prayer and supplication, with thanksgiving, let your requests be known to God. And the peace of God, which surpasses all understanding, will guard your heart and mind through Jesus Christ." So,
amen.
Definitely, when we get discouraged, you can reference those passages to kind of bring you down a little bit.
Get you through, It's amazing how God's word really just brings peace. And
it does. Peace and understanding.
Indeed. Thank you so much, Elaine, for coming, and we'll definitely have you back for a follow-up discussion.
Thank you. I had a fun time.
Awesome. We loved having you. So, guys, it's time for us to get out of here. Thanks so much for joining us today. Be sure to tune in again next week. We're keeping this conversation going. We have Dr. Donella Knight with us next week to help us work through some of those emotions and anxieties that we probably have. And she's going to give us some information about how we can kind of keep a peaceful mind in the midst of this crisis. Yes. We're getting more information and more tools to get us through. So in the meantime, have a great week. And remember, no matter what you're going through, we're your girls. I'm Kim with an E.
And I'm Kim with an I.
Bye.
Bye.
Hey girl, thanks for joining us today. We hope you enjoyed the show. If you did, please like K.Roper at Hey Girl on Facebook. Also, follow Kim Jacobs and Kim Roper on Instagram and Facebook as well. That's Kim with an I and Kim with an E. We have all kinds of Hey Girl stuff happening during the week, and we don't want you to miss a thing. Be sure to tune in next week, and don't forget to bring a friend.